Ha- Hey, you guys, it's that time of the year, so let's talk about it. Is it RSV, COVID, or influenza? I have no idea. Let's talk about it. So it's that time of year, you guys, and you know that cases must be rising when the CDC puts out a advisory to healthcare professionals and public health professionals to keep an eye out for respiratory viruses. So yes, our numbers are increasing, and now it's becoming a little bit more confused because some people aren't familiar with respiratory infections such as RSV and may have forgotten a few things about the influenza virus as we've been focusing on COVID for the past couple of years. But now we're in a season where we really need to pay attention to both RSV and influenza. So let's talk about it. So before we even get into the specifics about RSV versus influenza, let's talk about the respiratory tract because it's going to be important to know the respiratory tract before we go through some of the details about these viruses. And yes, these are viruses. So definitely don't ask your healthcare professionals for antibiotics because antibiotics are intended to treat bacterial infections, not viruses. For viruses, you need antiviral medications. That being said, let's talk about the respiratory tract. So the respiratory tract, as you know, we start with our trachea. And actually, first we start with our larynx, but we're going to skip that part. We have our trachea that travels down into our lungs. Now, our lungs have two sides. We have the right side and the left side. The left side has a superior and an inferior lobe. The right side has a superior middle and an inferior lobe. So on the right side of our lungs, we have three lung lobes. And on the left side, we have two lung lobes, one that's really gigantic and major, and the other one that is a lower lung lobe that's minor. So if you think of from the trachea, which if you think of it like a tree, you would think of the trachea itself, like the trunk of the tree. And it then goes out into branches. And it literally does look like this, you guys. So it goes out into branches from the trachea to what we call bronchi. Singular would be bronchus. And the bronchus are either primary, secondary, or tertiary. And from a bronchus or from bronchi, you then develop smaller subdivision, which are more like your twigs. And that is called your bronchioles. And from your bronchioles, you then have the end of the branches. Let's think of it as leaves. And those leaves are the air sacs in which gases are exchanged between our blood and the air from our external environment. And those are alveoli or alveoli, depending on which country you're from. And those are our air sacs. So when we talk about bronchiolitis, as we will in a few moments, we're talking about an infection, inflammation of the bronchioles. When we talk about pneumonia, we're talking about an infection that affects those air sacs. So now let's talk about RSV. So you guys, RSV has been around for a long time. In fact, it was first discovered in 1956. So this is not new at all. In fact, we've always had annual outbreaks of RSV. It typically will start in the fall and then will peak during the winter months. RSV, when we think of it, we think of children. And I should say RSV stands for respiratory syncytial virus. And oftentimes we think of kids because kids are the population that's primarily affected by RSV, especially our youngest kids, those who are under 6 months. It's important to know how the infection presents. Well, in adults, typically most adults will not get severely ill from RSV. Adults will either develop mild or no symptoms at all, similar to COVID in the sense that you can have the virus and not have symptoms. We're not going to spend much time talking about COVID today, but I will make some comparisons as we talk about these other two groups of viruses. So RSV will typically cause an upper respiratory tract infection, presenting as cold-like symptoms. However, in some cases, and less commonly, RSV can cause lower respiratory tract infections such as bronchiolitis and pneumonia. Now you guys know where I'm talking about when I say bronchiolitis and pneumonia, right? Awesome. In our youngest population, those under 6 months are more likely to be hospitalized and develop severe disease from RSV. In fact, 1 to 2% of that population will be hospitalized as a result of it. We are seeing very increased numbers of RSV cases this season. So keep this in mind. Let's talk about how it typically presents. In infants and young children, RSV will typically present with a runny nose, decreased appetite, and then usually 3 days later, they may develop they may develop a cough as a result of it. Now, in our youngest population, so those that are young infants, their symptoms may not be as identifiable. They may have more nonspecific symptoms such as irritability, decrease in activity, and sometimes breathing issues as they sleep. So keep that in mind. Now, the children that are more at risk for having severe disease as a result of RSV, some of them you can kind of predict. So children who are in the youngest age group, equal to or less than 6 months, those who are preterm or preemies, those who have underlying cardiopulmonary issues, so those who have underlying like congenital heart disease or may have chronic lung disease are more likely to develop severe symptoms. And similar to any type of infection, those who are immune compromised are always at risk for having more advanced symptoms and disease. And a population that you may not necessarily think about, but it's important for us to keep in mind. So children with neuromuscular disease are also at risk because this is the group that may have difficulty swallowing or clearing their mucus. Now, unlike the influenza virus and COVID, we do not currently have vaccinations, antibodies, or antiviral therapy available for those who are infected with RSV. So it's really important to prevent the onset of disease. And pretty much it's like any other respiratory virus, maintaining good hygiene. And we'll talk about that in a little bit. But also making sure that we avoid being around those who appear to have a respiratory infection, especially during the holiday season. Even though this is the time we really want to gather with family, we want to make sure that everyone leaves healthy and that no one really becomes severely ill as a result of the holidays. So maintaining good wisdom, especially if you have a newborn, making sure that you screen those who are coming to either help you care for your newborn, so your village, or those who are just simply coming to visit for the holidays, making sure you screen them for certain infections like pertussis, which we're not going to talk about in this particular segment, but making sure you know their vaccination, their exposure status, if they have any symptoms, influenza, RSV, and of course, COVID. But this video, we're going to focus on talking about RSV, and now we're going to go on and talk about influenza, because influenza has been around for quite some time. We're way more familiar with influenza, but we may have forgotten that it's important to keep her in mind, right? So let's talk about the influenza viruses that lead to the infection called the flu. So those who have been exposed to the flu may develop symptoms within 2 days after being exposed. Those who are contagious from actually having the infection will typically be contagious between the 3rd to 4th day after onset of symptoms, but can, especially in healthy individuals, can actually be contagious anywhere from 1 day before the onset of symptoms to 5 to 7 days after the onset of symptoms. The flu is seasonal, so unlike influenza, which is more annual, flu is actually seasonal. So you may be advised to have the flu vaccine at the end of the year, and then you may be advised to have another vaccine at the beginning of the year. That's just reflecting different seasons. It's important to know that each season can be caused by a different virus that causes the condition or the infection that we call the flu. And each season may differ. So the vaccines are really gearing towards the predictability of the strain that's more likely to cause the more severe and common outbreaks. However, there are other viruses that can cause the flu, just like there are a multitude of viruses that cause the common cold. So each season may differ from the season before. So you can have one season that's really mild, and then you have another season where you have more severe disease. So anyone who's infected with the influenza virus may actually have anywhere from mild symptoms to severe symptoms. And similar to what we talked about with the RSV, there are certain conditions that may make someone more likely to develop severe symptoms. I did not mention about pregnant women as an at-risk group in RSV because they're not. However, pregnant women are considered to be an at-risk group when it comes to the influenza virus, which means they're more likely to be hospitalized, have severe symptoms, and even die from the influenza virus, even though it's far less common than COVID. So an adult who has RSV, which again is more likely to be mild, may have a runny nose, sore throat, fever, a cough, and fatigue. Those are really the common symptoms. So let's talk about influenza. So those who have influenza may again have a runny nose, a cough, a headache, fever or chills, muscle or body aches. Sounds very similar, right? So that's why it's important to get testing. Testing is available to identify whether your symptoms are related to COVID, RSV, or influenza, because as you can tell, the symptoms tend to overlap. Interestingly, though the older population is considered to be an at-risk population for influenza, it has been shown that the older population is actually less likely to get the infection compared to children. So children are definitely the population that are more likely to become infected with the influenza virus compared to older adults, even though both groups are considered to be at risk for severe illness. It is estimated that the US population 3 to 11% will become infected with the influenza virus each season, but this is believed to be an underreported number, as most individuals who have the symptoms may not necessarily realize, because the symptoms can be mild, may not necessarily realize that they have the flu, because they may think they may have just a common cold, right? Or they may think that they may have some other infection like RSV. It's quite often confusing, and this is why it's so important to contact your clinician if you think that you may be ill and need to really identify what you may have been exposed to, either for yourself because you have underlying conditions that put you at risk, or for those who you may live with or come into contact with. And for the flu, it's really important that every year we consider becoming vaccinated. The most preventive measure is actually vaccination to protect us, our loved ones, our coworkers, those who work in organizations with us, from becoming infected with the infection, because you never know what underlying condition someone else may have. So those who are considered to be at risk, I already mentioned children, older adults, as well as pregnant women. But those who have chronic diseases such as chronic heart disease, chronic lung disease, are also more at risk for developing severe illness. And similar to all other viruses, those who are immune compromised. So we always want to protect those who are the most vulnerable in our population, even if we ourselves are considered to be healthy. And just to review, again, we do not currently have antiviral therapies or vaccines or antibody therapy for RSV. However, we do have a vaccine that's very effective for the flu. And again, the level of efficacy is reported oftentimes by the CDC, and it can differ from season to season because, as I mentioned, depending on the season, the virus may be different, the severity of the illness may be different, which means the virus is more virulent, more aggressive. And certainly the spread of the infection can be, the contagion factor of the virus may differ from season to season. So the efficacy of the vaccine may differ from season to season a little bit, but we do know that vaccination is by far the best way of preventing severe illness and the spread of the infection. So that being said, we also do have antiviral therapy. And as I mentioned, these are all viruses. They're not bacterial infections, though certain infections like strep throat can sometimes be a little confusing with viral infections. So it's so important to talk to your clinician if you think that you may be ill, because as you can tell, all of these infections are quite overlapping. However, the antiviral therapy is actually very effective. And so if administered in the first few days of becoming infected or developing symptoms, then it's very beneficial, especially for those who are considered to be in a high-risk category, especially our pregnant women. Okay. So that's why if you have some symptoms and you're not quite sure what infection you have, whether it's a common cold, whether it's a flu, we have testing. And that's what helps us, because even as clinicians, it's really hard just by symptoms to identify what someone may have, even though we may have an inclination, such as if someone has body aches, we're more likely to think maybe COVID, maybe influenza, less likely RSV, right? But again, these are not hard sciences. So it's so important to contact your healthcare group, get tested if you're suspicious, and ultimately, if you are at risk or concerned about your risk level, contacting and having a conversation about therapy such as antiviral therapy, if it's available for the type of infection that you're positive for. And your clinician will be able to share that information with you. And again, we do have antiviral therapy available for COVID as well, and antibody therapy available for COVID, as well as the vaccines. You guys have heard a lot about COVID and its treatments. I'm not going to focus on it today, but I just want to highlight things that are overlapping and the differences between some of these respiratory viruses. But in addition to treatment, and vaccine prevention, we all know that there are things that we can do to protect our families. So hand washing is very important. The influenza virus is believed to be spread by droplets. And so avoiding direct contact with someone that we know is actively ill is important. But also you can acquire the infection by touching surfaces that have the droplets and then touching your nose or your mouth, right? And so it's so important to continue to maintain good hand hygiene, making sure that we're actively washing our hands or using hand sanitizer to prevent the spread of disease. And even more so, we also want to make sure that we maintain good health. So if I have a chronic disease, you want to make sure that your chronic disease is well controlled. As I mentioned, those who are immune suppressed, have cardiac or pulmonary diseases, are at risk for respiratory infections. So you want to make sure that your disease or your condition is well controlled, whether it requires medical therapy or some type of behavioral therapy, whether it's with exercising regularly, making sure that you eat healthy. However you are controlling your disease, you want to make sure that you're at your optimal health when we go through these seasons in which respiratory viruses are more common. So I talked about exercising and keeping your body healthy and strong. And I talked about eating well. Let's not forget, also sleeping is important. That's when your body and your immune system really has an ability to fight viruses that you were exposed to all day. Every day, we are exposed to a number of viruses, GI viruses, respiratory viruses, right? And so we want to make sure that our immune system is at its best to do the work that it's made to do. And also, don't forget, keeping stress low is really important for our immune system. So that being said, I wish you guys an amazing holiday season. Make the right decision for you and your family, given the fact of all of these things that we talked about. Figure out how you're going to manage and maintain the health of your family and be able to gather together. And that's important for us to do, right? But we want to do so in a way that we don't put our families at risk and that everyone can leave our holiday season as healthy and maybe even healthier than we entered the holiday season. I thank you guys once again on behalf of Healthy Bump Club. I am Dr. T, the hand behind the handle of Healthy Bump Club, and we appreciate you guys supporting us through this past year. We appreciate you supporting us by watching our videos here on YouTube. Thank you so much for commenting, for liking, and for sharing. That's how we get the video out front in front of other people so that other people can benefit from the information. So please continue to like, share, and comment. It helps us to get in front of this virtual world. Also, we thank you guys for following us on our Instagram account, where you can find us at healthybump.club. And there you will again find different hot topics in shorter segments, but really up-to-date information on very important topics related to pregnancy, fertility, and the postpartum period. And thank you for hanging out with us in our stories on Instagram. We sit back and we have a good time. We laugh a little and we hang out, right? Just as girlfriends will do. And so we thank you guys for being a part of our village. As you can see, I'm wearing our gear today. And Village, again, is just a collection of a community of people who are coming together with a purpose of living healthier, more fulfilling lives. We thank you for supporting our merch. This is how we support what we do on the platform, how we're able to support the cost of being active in a lot of the community events that we do. So we thank you guys because you are the reason that we're continuing to keep the platform going. It is because of your support virtually, supporting our videos, supporting us financially, and those who are praying for us. We thank you, we love, and we appreciate you all. That being said, once again, we thank you so much for watching this episode. I hope it's been helpful for you. And we look forward to seeing you. We have a couple more hot episodes for the wrap up of this year. And we hope our last episode helped those who are going through a season of grief. We hope that it brings healing to you as you endure and go through this holiday season. And we hope that our upcoming topics at the top of the year, we're so excited, just brings you a lot more information and helps to support you in your health journey. Once again, thank you so much for watching this episode. I look forward to seeing you on the next episode.